Good morning, this is Dr. Reese again with Reese Dental at Lake Country. And I'm here to talk to you today about a subject that some patients find touchy and maybe don't understand, and that's dental x-rays. The term x-ray has a very negative connotation to it, in which many patients hear the word x-ray and they think, oh my God, I don't want radiation. And in general, they're thinking about radiation like the kind you get in cancer treatment, and definitely the kind of radiation that's used in cancer treatment and the kind of radiation that's used in dentistry and in medicine are very, very different. The radiation type used in dentistry is called ionizing radiation, and it's the same kind of radiation that comes from the sun. So sunbathing or being outside without a shirt or with short sleeve shirts or shorts, that allows your body to absorb the ionizing radiation from the sun, and of course we know that that can in fact cause skin cancers and other kinds of disorders, but it is not the kind of radiation which is, you would say, deadly on a reasonable dosage. It's something we're going to get normally simply because we have the sun in our solar system. A full mouth set of x-rays, which is normally, I believe, 18 for an individual person, gives one about the same amount of radiation that you would get if you flew in an airplane from Dallas to Chicago. And certainly people aren't afraid of flying from Dallas to Chicago or to LA, do it all the time, but they should be aware that they're getting the exact same kind of radiation that they would get at the dental office. Now, one of the most wonderful things that has happened is there's been a huge change in the type and the way we take our x-rays, the way we process them and everything else. The newer dental x-rays and radiology probably take less than 1/10 the amount of radiation that an x-ray would have taken 15 years ago. It has been a wonderful thing. Therefore, I believe, and certainly the American Dental Association supports, that there's no reason to be afraid of dental x-rays taken within moderation and according to the recommendations, which are generally a full mouth set of x-rays about every 3 to 5 years, bite wings, x-rays, depending upon whether you're decay prone or not decay prone, about every year. Certainly patients do come in and they say, Doc, I don't want you to take any x-rays of me, and almost always in my mind I know what they're thinking. They're thinking that I'm going to be getting excessive radiation and it's going to cause me skin cancer or even bone cancer or whatever, and that is not the case. There's just not that amount of radiation. But the buildup of radiation over time can be a concern, and the other big concern is we certainly don't want to radiate either pregnant or potentially pregnant women, and so we want to be sure that we use protective shields and protective layers and glasses and different things that we can use to help protect the patient so that they absorb as little radiation as possible. Thank you.